they join. But we can go ahead and get started here. All right. Sebastian, you want to move us to our agenda? Great. So, welcome everyone. It's good to see you all. Thanks for joining us today. I know it's a busy season for probably everybody. And so, we're just going to go ahead and get started, walk through our agenda. Sebastian and I will be co-facilitating today. So, I will lead us through our first few agenda items, and then we'll pass it over to Sebastian for our data and Erickson recommendations discussion. So, building on our discussion from our last PLC, and then I will close us out with an activity and some reminders. So on this next slide here, we are just continuing to make updates to the PLC based on the feedback that we're receiving from you all. One of the things that was noted was just this rushed feeling at the end of our PLCs, especially our last PLC. So one thing that we are trying is doing our announcements at the beginning to help prevent feeling so rushed at the end. And then we'll also close out this slide just with an opportunity for you all to ask any questions or share any current events that would be relevant to everybody here today. So as a reminder, before we go through these announcements and updates, please make sure to introduce yourself and just say what hub you are with when you ask a question or share for the first time. So we are going to start things off with our ECIC colleague, Amy Moore, to talk about ITCC. So I sent an email about it last Thursday in the upcoming cohort that starts on February 2026. But we also just wanted to make sure that you all had an opportunity to get any questions answered. And so I will now invite Amy to come off mute and introduce herself and role within ITCC, and then we can open it up to any questions. All right, Amy, I'll pass it over.
Thanks, Amanda.
Yeah.
Hi, everybody. I'm Amy Moore. I'm an Innovation Associate here at ECIC, and I'm working on the Michigan Infant and Toddler Caregiver Certificate project. I do know some of you, so hello. Nice to see some familiar faces. And to those of you that I don't know, hi, nice to meet you. Like Amanda said, some information went out about the certificate, and that is sort of like our basic information that we've got. So our next cohort is starting in February. We are actively recruiting for additional members for the cohort right now. I also have a bid out for contractors to help implement the work, but I would love to answer any questions that you might have. Or just explain some things more if there's anything sort of lingering after going through some of that information. So, what questions do you have? Okay. I'm not hearing any, so I'm feel free to type in the chat or whatever might need to happen. I am gonna put our web page in the chat as well. And then just give you that says great start twice. Great start to quality. A moment. I will also share the like big piece of this, the really exciting piece of this is that for any providers working with infants and toddlers that participate and complete the cohort requirements, they earn a $1,000 completion stipend. And we like desperately want to give this out. We're excited to get people through the program. I really want to be able to award these stipends and certificates for those that are working really hard in our field, especially with infant and toddler that population and their families. So I think that it's a great opportunity for those that you all are working with that are in these family childcare networks. This first cohort that I just completed last week did not have any family or group home providers. So I would love to get some of those folks involved as well as license exempt providers. People do not have to actively be working with infants and toddlers to qualify, but they do have to be interested or willing to work with infants and toddlers, excuse me. So, if you know anybody or you think that this might be good for some of the folks that you're working with, then please send them my way. I'll also put the infant toddler email in the chat for you all again as well. I see the question in the chat, what is the stipend amount? Again, it's $1,000. So once they complete everything and we process the applications, then we are awarding $1,000 stipends. There is no cost to join the cohort itself, but there is a $40 fee to take the 45-hour training, and that is available in Michigan Virtual. And so the 45-hour infant and toddler development and care practices training is sort of the like base for the certificate. So that does cost $40. We are also working on a scholarship program to be able to cover that cost for providers. So that way they don't have to take that on. And we do have money in the budget for that. So I see a couple of questions in the chat coming in. Could I give a brief overview of the time commitment for providers? Yes, absolutely. So the biggest lift of this is that 45-hour training. And so it takes roughly 45 hours to complete. You get 45 training hours. I did it myself and it did take a while to go through everything. But it's a lot of information and is self-paced, so can be done as folks have time. There is sort of a 6-month window that it's open and available once they register for the training on Michigan Virtual. So that has to be completed within 6 months, but can be done at their pace. The other requirements that we are requiring the 1 hour infant safe sleep training that is available on my registry that was created by MDHHS. So that's 1 hour. And then we'd have 5 1-hour individual coaching sessions, 4 1-hour group sessions that are required. So we've got about 9 hours there. And then a few other requirements that, based on data from my first cohort, took around 3 hours to complete. So that would be including a statewide office hours offering, and then a couple of additional documents, writing a philosophy statement, completing a reflection tool. So with all of that, we're looking at like roughly 60 total hours to complete everything over 5 months. If they have already completed the 45-hour training, they don't have to take it again or anything. That's all good. So then that would be taken off, and we're looking at about 15 hours over 5 months. Of course, Jamie, I see asked about if there are different cohorts for center, in-home, and LEP providers. There's not at this point in time. We didn't have the need for it with our first cohort since everybody was a center provider, but it is definitely something that is an option. So we kind of get to decide how folks are broken up because our only like eligibility requirement is that they have not taken 3 college credit hours in infant and toddler care, and that they don't already have like an infant toddler CDA.
Sorry if I could just ask a
Yeah.
clarifying question. Yeah, I had just wondered about that because obviously the roles are all very different, but I think specifically about LEP providers. And that role is oftentimes very different from a licensed provider role. And oftentimes the level of support that those provider needs is much different. And so like I think about LEPs, is there support for completing the training, or like what's the language level of the 45 hours? I just wonder if they would feel it's supportive of them.
Hmm. Yeah, absolutely, Jamie. I am not 100% sure about that, like language level and things like that for the training, but that is definitely something that I can follow up with Robin Zeider about, since she's sort of been my like liaison with that. And so I'll just make a note of that real quick. But it would definitely, we want it to be as supportive as possible. So the goal would be to be able to meet people where they're at with that. So whether they are an LEP and needing those very specific supports that license exempt providers often do, like it's very different per provider typically, where even and with home providers too, but whereas licensed providers kind of run into some similar struggles sometimes or needing that assistance, and license exempt providers, it's pretty specific to the person. So yeah, the goal would be to be as supportive as possible to the individual person and be able to meet their needs to support them getting through the program. So whatever that might look like, that would be a conversation that that person could have with their coach.
Also, on that note, just really quick, I think given that ITCC is so new and that it hasn't yet had home-based providers in it, I do think there might be an opportunity for networks to like give information to you all. Like perhaps we like do another check-in and think about what are the specific supports that are having great success with license exempt providers, because we do know, and we'll talk about this a little bit more today, that license exempt providers are requesting information about child care quality practices and how they want to advance their skills. And so there is this like question that I think we're all working on, and we could learn from one another about what are those supports that really like support successful completion of things like the trainings that you're talking about, Amy. So just wanted to raise that too in the conversation for folks.
Yeah, thanks, Sebastian. I did see the question in the chat about the family childcare CDA. We have not explicitly said that a family childcare CDA excludes or makes somebody ineligible. Um, I will say that I personally do not know as much about the family childcare CDA as I do about the infant, toddler, or the preschool CDA, which also is relatively limited as I've like helped people with it, but not necessarily been directly involved with the CDA process. So we are not currently actively saying that people with a family child care CDA are ineligible. Also, a preschool CDA does not make you ineligible. It is only that like focused, fully infant toddler CDA.
And then
And
Amy,
then I saw the other question, sorry, about what is their next step after completing the interest form. So that will be kind of this first step here, complete the interest form, and then I am reaching out to everybody that completes the interest form with eligibility updates and everything like that. The interest form is due January 23rd for the February cohorts. And then from there, they will be contacted by me and kind of asked if they still want to participate, but then sorted into different cohorts. We're planning on running multiple cohorts at one time in that February to June period. What other
wonderful.
questions might you have? Oh, great question. Everything is virtual. We are looking for statewide representation, and sorry, I'll repeat for the recording. Are the sessions in person or on Zoom? Everything is on Zoom or whatever video call method might work best for everybody. I used Zoom personally. But yes, everything is on Zoom, so that way it's accessible. And I did get some feedback about maybe doing some sort of Zoom training, so that might be something that we go forward with in the future. But for the most part, for the folks that I was working with this first time, that seemed to work pretty well. And if anybody had any individual issues, then I would just troubleshoot with them. But overall, that worked well and it was great. I was able to, so I live in Southeast Michigan and I had folks from the Northeast, Northwest, up in the UP, and we were all able to connect that way. for the LEPs in our county. Virtual platforms are difficult to navigate. Yeah, thanks, Jamie. Definitely will continue to take that into consideration as we think about sustainability for this program as well and what that might look like going forward. All right.
So Amy, instead of typing this in,
Yeah.
Deb with the UP, just gonna ask a quick question. So we've got ITLC, we've got learners, we've got FCCNs, all plus our everyday coaching, right? All vying for participants. I'm wondering if you can talk to the benefits of other than best practice and IT, more IT information. What would the benefit be to FCCN member that's already engaged in that cohort and potentially also being part of the learners cohort? I just feel like we've got, we're vying for the same amount of people.
Yeah. And we're throwing so much at them all at one time, right? Like join this, join this, join this. Yeah. So the focus of ITCC is yes, on best practice, of course, we're always going to talk about those kinds of things, but more on career planning and progression. So this certificate has been sort of designed as something for people that are maybe earlier on in their career, or maybe haven't really had a lot of that formalized training, in higher education or anything like that. So it's been designed as a support to help with that career planning and progression. So of course we have our family childcare providers. Many of them have been doing this for, 20 plus years, right? But there are also people who have maybe only been doing this for a few years and might want to explore where they're taking their business, and things like that. So it's really meant to be sort of an individualized support on where they are right now with their career and where they want to go. And then also those best practice pieces and how that can help them move forward as an educator and in their career as well.
Appreciate that.
Yeah. I also will share, I do have a couple of people that were participating in the infant toddler learning community. They joined their infant toddler learning community while they were part of the ITCC cohort, and they expressed that that was something that they were able to take on. So of course that's going to be different for every individual and the capacity that they have. Especially with home providers, we know that their capacity, they are the person, so they're open from 6 to 6 and they're the person that's there all day long doing that. So after a 12-hour day, joining another meeting in the evening might be challenging for them. But like I said, we're really hoping to be able to just directly support folks in the way that is working for them. So while it might be a little bit difficult, everybody knows their own capacity, so they get to make that choice.
Amy, I just wanted to lift one of the comments from Kim. She just mentioned just in terms of virtual platforms being difficult for those who need language accommodation. So just didn't want to lose that one in the chat as well.
Thank you, Amanda. Yeah, and thank you for that, Kim. That's definitely there is something I believe written in for us being able to support with language, but I'm not 100% sure how that's written, so I don't want to say something that is untrue right now. But we were looking at translation services and things like that to be able to support. I'm just not 100% sure what that looks like at the moment because it wasn't something that I had to utilize in my first cohort.
Can I get off mic a minute?
Yeah.
And it's not so, I appreciate that answer. Thank you. But it's not so much about translation. I love that we're seeing an expansion of the availability of trainings and resources virtually, but it saddens me to see when that leads to the elimination of in-person
Yeah.
opportunities. And that I think particularly impacts, not exclusively, but it does impact those needing the language accommodations, because more than needing translated materials, they benefit from being in person, having those discussions, learning through visual examples. And so I just want to kind of highlight that and make
Mhm.
sure that we're advocating for those resources.
Yeah, definitely. And I appreciate that too. I came from the resource center, so I used to be a quality improvement specialist and coach. And so I heavily supported those in-person meetings with my people and hosting in-person trainings and all of those sorts of things. So I definitely hear you. And I think again, that's something that we want to look at as far as sustainability goes and moving forward and what it might look like as the work continues and how else we can support people.
Thank you.
Yeah, thank you. I'm so sorry to Sebastian and Amanda because I feel like I've taken up so much of your time, but um, I will put my email in the chat so you all are more than welcome to reach out. I'm happy to set up a individual call or anything like that, communicate via email to be able to support, but I appreciate the time.
Thank you so much, Amy, and please don't apologize. We definitely wanted this conversation and wanted this opportunity for people to get questions answered. So thank you for your extra time today to do that. And again, just a reminder about that January 23rd deadline for interest forms and the cohort starting in February 2026. And also just that it might be a good opportunity for program assistants to Seb has that in the chat as well. So just wanted to make sure people saw that. So next announcement in regards to the home-based pre-K pilot. If you were already registered for the webinar, you probably saw the cancellation notification that we just got before joining this PLC today. So once we learn more, we'll be happy to share new information as it comes. But for the latest notification is that webinar has been canceled. That being said, we can still support with getting questions to MyElite for publication in an FAQ that they're working on. So if you do have any questions, please email me and I will make sure to lift those. I think you all should have my email by now, but you know what? It's always good to just have it accessible. So I'll throw that in the chat as well. And then the GSQ public search. So for non-RCs, the guides are coming, and just want to encourage providers to make sure they're entering enrollment numbers and updating enrollment periodically as well.
Yeah, just really quickly on that. That's when they log into Great Start to Quality, they will be getting prompted to enter their enrollment numbers, like their actual enrollment, the enrollment that they're offering. So there will be just more of a prompted reminder. And it is up to them whether they want to participate in that, but the prompts and reminders will be there. So more of a guide will be available as well.
Thanks, Seb. We also, so for the FCCN TA events, it is live now. We do want to note that you'll still be completing hub surveys because we don't have direct access to your reports in the My Registry system. So did want to flag that. Anyone who's already emailed Seb with a list of staff that need access to this being entered in the system, just please check for access on Friday. And let Seb know if there's any issues there. And then you can email Dana Frederick if you'd like access to this reporting tool. And also for non-RC hubs that want to learn more, Dana can also set up a demo. Oh, Shemaine, I see your hand up.
Oh, sorry. I just wanted to know, I thought I read that even if we use this reporting tool, we still need to send it the old-fashioned way as well. Is
Yes.
that
So
correct?
this reporting tool is not a shortcut. It really is just if you're already if any hub is already using a mechanism that allows them to track their technical assistance events, that's fantastic and great, and we would encourage you to continue using that. However, there has been we heard about the benefits that could be provided, especially with folks that use my registry for a lot of their technical assistance tracking to be able to do that all in one place. And so really this is an update for folks to have all of that in one place. And I will say that the video, Dana has put together a video. It's 11 minutes long. We will provide it in the post PLC email. So if you do use something else and want to see what it looks like in my registry as like a demo, you would be able to see that. And if you have more interest, we can definitely make a connection for you to get set up, even if you're not a resource center. Folks can use this tool. But like I said, it is optional. It's not shortcutting for anybody, but it is putting all in one place, reporting that other hubs that have a sort of big responsibility for that are already using.
Thanks, Sebastian. And I did just put Dana's email in the chat as well, so please feel free to reach out to her. And then lastly, just wanted to open up some space and time for anybody to add any updates from the field that would be helpful for everybody else to know about here on the call, or if there's any questions.
We can also have if things come up for people that they want folks to know, we can put that in the chat, and then we will review that and include it in our post PLC follow up. So I'm going to move us to the next slide actually, so that we can keep moving right along. Amanda, do you want to cover this section?
Yeah, sounds good. Okay, so we do have one new update today in regards to gift card use, and I've provided this language here all on the slide. So just to highlight here, so gift cards, we've confirmed that they're for planned network meeting compensation only, and want to make sure that they're clearly outlined in the budget and budget narrative. You'll also see here the hub. As the hub, you must ensure that adequate tracking, documentation for purchases and distributions of gift cards purchased with federal grant dollars. If as a hub, you're going to be supporting network members with making purchases, supporting the cost associated with licensing. Gift cards aren't allowable in those situations. As a means of conducting that transaction because of there wouldn't be an adequate paper trail. So that's just some of the reason in regards to, in case of an audit, that is the why behind that. And lastly, so for all purchases for providers, the hub organization must make purchases following whatever your organizational procurement policies are. And so just making sure that you're appropriately tracking those expenditures to budget, and making sure that those details are documented in your monthly SOE. There is just a note that ideally you'd be doing those purchases on behalf of the provider, but depending on your specific organizational policies and what's allowed, just the hub can reimburse the provider if the purchase is made within that project term. All right, and then lastly, this update to the guidance document is complete. So I will add the link to the guidance document in the chat. But also just know that we will include it in the post PLC email for you to access it that way as well. Oh, sorry, Seb, I saw you already did that.
All good, Amanda.
Computer's slow to update. All right, well, you have it twice. All right, well, we'll keep things moving then. So our next section will be covering our prior PLC questions and comments. As we work to address items that were noted in previous PLC surveys. And so as we're considering each of these following questions slash feedback. I'll be sharing some guidance, but also would love if anybody's willing to come off mute and share their perspective. And just adding, there's no right or wrong answer. We just, simply want to encourage just that sharing and what has worked, for your network, just in case that sparks any ideas. So for the first one that we got was just, I would like a specific definition of what stipend should be given for participation in FCCN meetings. And so provided just some guidance down here in terms of stipend calculation examples. So looking at, transportation plus funds for a substitute plus compensation for network member time. And want to emphasize that the goal is, to make sure that compensation is reasonable, fair, and not an incentive. So really keeping those bolded items in mind, as well as some further language, outlined here on this slide. Seb has also dropped a link to ECIC stipend examples just for some further guidance as well to help support you with this also. But I also, just want to pause here and see if there's just any feedback or comments.
I wonder how people are handling providers who work non-traditional hours. I'm running into that with some of our providers who can't attend our in-person weekly meetings because they have children in the evening. So if anyone has any suggestions, they can put it in the chat possibly of providing a stipend for them.
Thanks, Shemaine.
Also, Shemaine, just really to clarify, is the challenge, so are they able to attend at all? Basically, are they busy during that time? In which case, it would be acceptable for them to identify what stipend they would need in order to find a support there to enable them to join the meeting. I know that
Right.
there's a lot of challenges, especially around finding substitutes and things of that nature, but that's the kind of conversation that can take then. If it's something that's keeping people from participating in a meeting, there's a conversation that is possible around what would support them to be able to attend, and the stipends can be utilized for that. That's why there's not a strict yeah, stipends have to be this exact amount. It can be based on real barriers that are coming up, and so if that specific challenge you continue to face that, I think that's something that we could also work on in a kind of one-on-one setting.
Thank you.
Great, thank you. Okay, we'll make sure to share if any comments or feedback come back later. We'll make sure to get that back to you, Shemaine. All right, so moving on with our next question, feedback from our November PLC survey. We had someone that were looking for tips and tricks for what to do with children during the time that the consultant needs the attention of the provider. And just wanted to pause here before I go into the second part of this slide and see if anybody is willing to come off mic or drop any ideas in the chat for our participants. Well, and as some people might be thinking, I will go into the second part here and just note that these next two questions are things that we want to make sure that we're specifically raising to the Licensing Bureau for just for some language and support. in terms of like what specific areas of the home are being evaluated, and are they allowed to go into spaces not licensed or available to children if it is a renewal or interim rather than an incident investigation. So just noting that we'll be raising those two specific questions to licensing at our next available opportunity. I do see we have some comments coming in the chat that Kim mentioned they always communicate with providers and try to schedule visits during nap time, off hours. Those are great ideas. Julie also noted wondering if bringing some new materials from the GSQRC's lending library that might be able to keep little ones engaged and busy close by. Another great idea. Thank you both for sharing. Great. Well, we'll go ahead and move on to our last question, feedback, in regards to just having some intentional time dedicated to nurture benefits and plan comparisons versus ACA. So here we just wanted to share some resources that we hope can be helpful if you don't already have them. So I'm going to include, Sebastian's on it, just two links in the chat here. One is estimated prices, so the link to that, as well as an interactive tax credit calculator for support there. We also wanted to just lift and remind everybody of upcoming deadlines as people are reviewing and weighing their options. So for ACA, December 15th was the deadline for January 1st coverage. However, there is another upcoming deadline for as of January 15th, 2026 being the final deadline for February 1st, 2026 coverage. I also just wanted to note here, there is no enrollment deadline for nurture benefits, but just noting that subsidy funds are limited, but may become available throughout the year depending on enrollment. And that is direct guidance that we received from Nurture Benefits last week. So just wanted to lift that information, and then just wanted to pause before we move on to our next section to see if anybody has any additional questions or learnings that they would like to share as everybody is taking in this information and reviewing it. And actually, I see Kim's dropped a question in the chat. Has ECIC received any recent feedback regarding nurture benefits interest and or participation to date? So Kim, are you talking in regards to our hubs? That is, something that we have asked you all about what interest looks like. And I think, the overall, learning and consensus that we've heard is just that initial sticker shock. And I think, just some varied thoughts in terms of, potentially looking, maybe being interested in just retirement or just vision dental as a way, to kind of support those costs. But then I think that other piece of just encouraging the research, in terms of, what some of those what some of those new marketplace costs could look like. And considering that when, you're weighing the cost of nurture benefits as well. And Julie, I see you have your hand up. I'll let you come off mute.
Sure, thank you. Just wanted to share, I did reach out to Nurture Benefits, and we do have somebody from their team actually coming to one of our resource center meetings, which also includes our FCCN specialists will be attending that with us as well. And so just encouraging folks to maybe reach out to them directly and see if they'll, either join via Zoom or in person to answer the questions and just talk a little bit more in depth, maybe even to your network as well. We're starting just with our team first, but there might be more to come. And then just regarding price, because we have heard a lot of the same sort of thing of it's really expensive. However, I was talking about it at one of our local GSRP meetings, and there was an individual who, in her words, said, well, maybe because of my age, and she was a little bit of an older person, she said it was actually cheaper for her to utilize the nurture benefits, and so she was going that route. So I think it might be based on individual needs and things like that too. So just putting that out there.
Thank you, Julie. And thank you for lifting as well that direct connection and inviting Nurture Benefits to come speak. We've also heard that as well from at least one of our other hubs, and how helpful they were when you have that direct question and answer with your network. So that is some, great guidance and advice as well. Any other questions, guidance, feedback in regard to Nurture Benefits before we move on? Okay, great. Well, thank you all for the great discussion and feedback. We'll continue, really ensuring that we're, not only reviewing the survey questions and feedback that we're receiving, but then making sure to report back out and have some discussion during our upcoming PLCs. And lastly, before I hand it over to Sebastian, I do see Shemaine left a note here that my side has several family providers interested in Nurture Benefits, with some mixed reviews just in terms of the pricing. None of the providers received the stipend, and so wondering how many stipends were provided. That I do not know. So that is, something good for us to monitor and to look into as well. Okay, well, thank you all. And I'll pass it over to Sebastian so we can get started with our data evaluation review.
Awesome. Thanks so much, Amanda. And thanks everybody for working through this complicated time as we're waiting to see what happens with the overall healthcare subsidies. That makes things really complicated. I think the tools or the follow-up that Amanda did, the follow-up that you all are doing with Nurture Benefits to keep kind of in the loop with them is really important. And that calculator, as Julie was pointing out, people with different ages, like there's so many different factors to measuring these things. So we were hoping that calculator might be able to provide some insight. It's not perfect, obviously, because we don't know what the federal government will decide, but some insight into having those conversations and planning for what's to come as far as the cost. So hopefully we definitely need to continue having that conversation as we move forward. All right. So I also wanted to, we wanted to follow up on a few of the slides that we went through very, very quickly last time. We wanted to just slow down a little bit, take an opportunity to actually look at some of the data and give opportunities to discuss it in a little bit more depth. So that's what we're going to be doing in the next for the next little bit here. And so just as a reminder, there's a lot of data in the previous slides, and we're not going to go over all of it again. So for the demographic information, if that's what you're curious about, wanting to dive into a little bit more, the previous slide deck has that info in there, and I would be happy to discuss it with anyone who had questions. But the data that we're going to focus on today is really about the sort of program metrics that we're looking at, and we're looking at continuing to support in FY26. So in FY25, as we mentioned, we saw membership rise throughout the year. I think a big theme of 2025 was it being a year of growth. We onboarded many new hubs, and we continued to grow our existing networks. And so one of the things that we were able to see is that there were increases in FY25 to folks who were getting licensed. And so we knew that, or we were able to find that we saw increases in capacity with a variance for 11 network members while they were in their network. 5 folks were licensed for the first time, and others changed their license type. And so one of the things that we learned as we were doing this reporting phase is the lag that can happen with our data. So we know that there were more providers that received support with these services because they filled out their provider network survey saying that they received supports, than actually show up as like, yep, we're in the licensing system as achieving that next license or that variance. And so what we're working on doing is continuing to review that as we move forward so that we can always understand like when people started working on their licensing support and also understanding like when they actually achieve that license. I know, for example, early in October, there were already 5 or 6 providers who had updates within the licensing system that are then going to be reflected in our next quarter of reporting. And so this is just shifting how we talk about our sort of end of year results compared to an initiative that we're working on that is multi-year. So we're making sure that when we report to MyLeap, for example, we explain and demonstrate the lag that can be part of that. So before I move to the next slide, does anyone have any like questions or thoughts about this? Try to keep an eye on the chat as well. All right, so then moving to the next slide, the other thing that's really valuable for us to continue to review is thinking about Great Start to Quality and how Great Start to Quality interacts with family childcare networks. So this is connecting with the work that folks at resource centers are doing to support quality and how FCCNs can be supportive of that. And so what we saw was that 61 licensed home-based providers increased their quality level while in an FCCN, which is really, I mean, that's really awesome. But again, just like with the licensed, just like with licensing, we learned from our ECIC colleagues that work directly with Great Start to Quality, we learned more about how long the actual like on-site reviews are taking and how long the scheduling process is taking to get there. And so this is another area where we identified that there will necessarily be a lag in the data that we get. So we want to continue to combine data sources to understand when folks are looking and working on Great Start to Quality like when they're in the system of Great Start to Quality and are taking steps within that system. We want to be able to record those folks in FY26 as taking those actions. But the other thing we wanted to really point out, which we feel is a real strength of FCCNs, is that we do have 26% of our network members join while they're at their maintaining health and safety level. And so there's a lot of opportunity for folks to join before perhaps they've started thinking about or working on working with their resource center. And so you play a integral role in connecting people with the quality system and supporting them obtaining mentors or people that can give them examples of what it looks like to work through that. Does anyone have any questions or thoughts related to this? I'm checking the chat as well. All right. And then one other slide to review from last time, and that I really want to highlight, is the importance of staffing the networks. So there are huge positives that we see across the board when it comes to the hard work that the FCCN staff are doing. So we can see, for example, that 61% of our current network members take advantage of TA offered outside of meeting time. That is huge and really significant. We can also quantify the amount of support that program staff are providing. And of course, these are huge numbers because we serve a huge percentage of this, 15% of home-based providers that are licensed in the state are supported by an FCCN. And so the numbers of TA are really impressive. And we can see that over time, on-site TA is increasing. We can see that, again, similarly, as folks start to build up their networks and build those relationships with their program staff, that also increases over time the amount of TA that they're receiving. And in particular, we were feeling very positive about the TA topics distribution. So when we are doing those TA event reports and when you are filling out our SurveyMonkey that we do, like the one that is currently available this month, it's really helpful to us to see the distribution of what folks are asking for, because it supports the understanding of the state about how FCCNs provide a unique perspective and a unique support to home-based providers. And so we saw that business supports were most common. And then we also had quality and referrals and technology support in our sort of top three. The one thing I wanted to also flag here was the uncharacterized and other section. So we did have a large proportion that fell into that other support category. And that's something that I really wanted to kind of hone in on today. So we're currently looking at our first quarter data. So the data that we're looking at the end of the year data in that other category, all of the things that you wrote down. But we're also looking at this first quarter to try to get a better understanding of what is not captured by the existing categories and try to add those categories if needed. So I wanted to kind of say two things. The one is I would love to hear from you about things that you feel like are not categorized or don't have categories yet to support you. But then secondly, I really wanted to remind us to review the implementation guidance manual, because it does have some support and clarification about what we mean by each of those categories. And so that's something that we can review together, because our main thing is I would really love to be answering questions for you if you feel like the tools that we have that we currently have available are not capturing adequately the types of support that you're providing. So I'm going to pause for a second, and I would love to hear from folks who, what kind of falls into that other category of hub or staff support. TA. Does anyone have anything that comes to mind?
Yes, I was pressing all the buttons here.
I totally understand.
This is Lisa Stockwell, and I'm from the Four Cs of the UP up in the UP. One thing that I noticed that many childcare providers are asking for are locations of grants or how to write a grant. And I put those things those were my others.
Perfect. Thanks for sharing that, Lisa. I definitely would lean toward that being a business support because it's about funds for the business. It's a skill set that's attached to that. But that's a really great point. I think it would be really helpful as well as you're sharing these. I'm taking notes on them because we can add them as examples that will help to illustrate for everybody where things might go. So does anyone else have anything like that doesn't necessarily fit?
Sebastian, do you think that the knowledge of writing grants, you see that as a business support, you said?
I do, yeah. We would frame it that way in the context of the any skills that are associated with funds for the business, we would put in that category. So grant writing falls into that because it would help. It would add another income stream to help with specific things. Oh, I'm seeing some great ones come in the chat. So we've got my registry support, finding and registering for trainings, completing required trainings. Absolutely. I think it really depends for that one on, that's a really great one because it could fall into multiple categories. So definitely need to think about this, my registry support in terms of whether that's a technology support, like is someone struggling to utilize the platform, or are people having a difficult time finding specific trainings for, let's say it's about quality that is sort of reflective of like what they are specifically hoping to learn. That might fall into a quality support because they might say, well, what I'm finding is not, I'm able to find stuff, but what I'm finding is not working for me. And then you're providing more of a quality-based support as opposed to helping them just with the technology. These are really great examples. Kim, I see your hand is raised.
Yeah, thanks. Kim with Bethany Hands Connected. And you may have just covered some of that in your response, but I feel like our technology support is underreported because in almost every case where we're providing CDC billing support or licensing support, we're always also providing technology support. So I'm wondering if there's a way we could better capture the amount of technology support needed.
Yeah, that's a really great point. A lot of these might be dual categories, and so I do need to do some more thinking about that. I've taken note of that point as well.
Okay. Thank you.
Thank you for raising that. I think so. Sarah, I see put in the chat also about translating, clarifying that kind of work. So a category that's best for that. That's another one. I think Kim would also say like that feels like it falls into that same thing of like a dual category where you are probably doing translating in support of something else. And so I'm going to make a note as well about translating being another category that that is likely being underreported because it might fall into something else. So we'll definitely have more of an update for you on that. And also as a note, for the reporting that you're doing currently, definitely feel free to like send an email questions and we'll provide an answer to them. But the guidance that we provide on this will be for the next quarter where we're really diving in. So we will get that information out to you so that as you're doing your the reporting for the next time, it's available. Great. Thank you so much for those notes, and definitely, like I said, please do reach out to us, or we will look for more opportunities as we're reading the notes of what was put in other. We'll categorize that, summarize that, and share that back with you as well to make sure that we're understanding exactly what is missing in there. While I will say, still trying to keep it straightforward to fill these out. Okay, so for this next section, we did not have this on the slides last time. And so what we're going to do is we're going to contextualize some qualitative data that we received together. So on the screen, there are major themes that we identified in the services requested section from the September network member survey. So these are themes that were sort of broad. There were lots of responses that fell into these themes, but we provided a quote that we felt like really highlighted what was behind the scenes of those themes. And so here's what we're going to do as our kind of activity for this section. I'm going to launch a poll for these, and it's going to ask you to identify which of these services or needs have you heard from your networks? Because obviously this is from the aggregate. So it may be relevant to your network and it may not. So you'll select all that you've heard. And then also the next question will ask you to identify which you have a plan towards solving or already doing something to solve. And then at the end of that, I'll share the results on screen. So we'll have we'll be able to review the results of the poll, and we'll do a brief strategy share out for those things. So I'm going to go ahead and find my poll and launch it. So this is the childcare related services, broken up by who requested them. So we had licensed exempt providers separately from licensed providers in this section. Let me launch this. Okay, I need one thumbs up from somebody that this is launched. Okay, great. Thank you so much. So go ahead and select all there. And I'm also reviewing the chat if I can here. Okay. All right, I can see the responses coming in. That's fantastic. I think some of the things that jumped out to us, and Amanda, feel free to fill in here as well. Like, I think some of the things that really jumped out to us were when we were reading the quotes and seeing how people were asking about specific services. So, for example, we know that a lot of people report to us that we see a lot of great outcomes when it comes to utilizing the food program. So it was interesting to see people kind of dive into that more deeply in what they were asking for as far as continued services. All right, I'm going to leave the question up for about 5 more seconds. Oh, Barbara, I'm sorry about that. We're going to be launching a few of these, so I will keep trying to make sure that you're able to see them. So I'm gonna, all right, 4, 3, 2, 1. I'm gonna end the poll and I'm gonna share the results. So hopefully this comes up on your screen, pops up on your screen. I know people might be, I definitely need to think about the polls and how people might be joining. So I'll try to share what we're seeing. So everybody who responded is agreeing and seeing and hearing a lot of requests for support with behavior and special needs. And then we have about 60% who have a current plan to address those challenges. Is anyone willing to come off of mute and talk a little bit more about what kinds of questions or what kinds of supports people in your network have been asking for related to behavior and special needs?
For us at CCN, we were they're talking specifically emotional, like social emotional behaviors and things like that.
Thanks, Sarah. And on that note, so is that so for folks who have, it doesn't necessarily have to be Sarah, for folks who have started to think about these or work on these things, this is another area where we have seen a lot of FCCNs provide training and supports. And so I'm curious if folks can share with people who may not yet have a strategy for responding to some of these requests, what services or what supports have you worked on providing? Also, please feel free to use the chat because we'll record what everyone is sharing and share that out too.
I can share that we've looked to our local ISD, so like Washtenaw specifically, and had some speakers and different people come into our groups and talk specifically about the infant, toddler, and then the older, younger kiddo mental health stuff, and that has been super helpful.
That's great. Thank you for sharing. I also see that Kelly added in the chat about bringing in the social emotional consultant in the county. I know it was kind of tacked onto an email that we sent out previously, but there are supports available for consultation. Kristen?
Yeah, our folks have, of course, continued to talk about it too. One thing that we did last year, and so this is a little bit prior, but I wanted to share it with the group in case you wanted to reach out. We did have Discovery Source, one of their trainers, provide a training on the Tucker turtle. And then even though this was not with our FCCN funding, we were able to offer them a discounted rate. We covered a part of a rate if they wanted to order one of the Tucker Turtle tool kits. So not something we've done this year, but something we did in the past. And I can find that contact and send it to you because they were really great. And they also provided a training in Spanish as well.
Wonderful. Yeah, thanks so much for sharing that, Kristen. And yes, we'll get to this as well. We are continuing to work on our resource sharing tool. We hope to have that launched really soon. And we will ask for a little bit of feedback about what would make that most useful for you in the post-PLC survey. So Kristen, if you could send that over, I will definitely make sure it gets shared out with everybody. Michaela, thanks for also sharing. Yeah, care for children with autism has been a really big question that we see a lot. So Michaela's pointing out as well that Arbor Circle and Early On have been great resources in that regard. And I think that really gets to what we're talking about too, as far as resourcing folks is really important. And then also checking in and seeing like, how are those resources actually being supportive in their childcare setting? Because the question, this is one of our biggest areas where we get services requested. Yes, Lisa.
One of the things that our providers are really interested in is if our requests of children match what brain science says they're capable of at that age. And so we have tapped into Julie Sizemore, who is from GRCC, And she has really helped us understand the why behind behavior and to think about the why and about the brain science, and then to go forward with the best way to respond or the best way to help a child learn.
Fantastic. That's definitely another resource we'll store for everybody after this PLC as well. I see Julie is thumbs upping your note about Julie S there. All right, so I also want to pivot and ask about license exempt providers. So we'll do one more on this slide before moving to our next one. We saw quite a few license exempt providers really talking about very specifically about working on the childcare quality or the childcare services that they are providing and increasing their knowledge around the tools and the practices that are going to be most supportive to them. And I'm curious if anyone could share more about what you've heard, like what are license exempt providers specifically looking for when they look for supports on tools, and also maybe tying into what we heard earlier in the meeting, what has been effective so far, or what are you planning as far as providing those additional supports for license exempt providers? And it's okay if we don't currently have any. That's also something that we can continue to think about as we go. I know people do have plans about it, but sometimes those plans are still in the stages of coming together. So we'll definitely make sure to share that out. All right, I'm going to go to the next one. The other one is we got quite a few business-related services requested. So we heard things about back office supports. So really, again, trying to figure out what is the right level of support in terms of how to fill out documents, like what it takes to do that, versus providing a doc or giving access to documents. I think that challenge definitely came up. Thinking about benefits. So we hear all the time about the cost of benefits, but also what benefits are folks looking for. Legal supports even came up. So really thinking about protection and legal rights. So understanding what rights they have as home-based providers. Staffing came up a few times as well, thinking about finding and advancing employees when it can be really, really difficult. Even in a center, centers are having a difficult time to find employees. Home-based providers are really doubling down on that need and potentially looking for supports that might help them there. And then also affordability, as we know, we just heard from Lisa talking about grants, but also thinking about people had asked about materials, bulk purchasing programs. I know many of you all already do have lending libraries, but thinking also in that context of making each dollar go further in the expense side of things. So I'm going to open up the poll really quickly. It's the same questions as before, just weighing in on what you have. Wait, hang on, sorry. Let me make sure this is possible to share. There we go. Okay. So same questions again. I've launched the poll now. So if you could again just share what you have heard, which of these needs you've heard from your network members already, and then any that you have a plan to address. I'll leave that open for a few. And while you're filling out the poll, definitely feel free if any of these are raising a question or a comment, please feel free to add that to the chat or come off mute as well.
Sebastian, I should probably know this. I'm sorry, I don't. I know our Regional Child Care Coalition is working on that pipeline. That's one of our subcommittees. And is that statewide or is that just something we each choose individually, the RCCC?
That's a great question. So the RCCCs, I know each are assigned a region, and we would encourage every FCCN to be connected with that because the RCCCs don't necessarily always have access to the information that you have access to, given your close relationships with the home providers in your community. So, if I'm understanding the question correctly, it is a statewide thing, but they're each working kind of regionally, and so I think that's another opportunity area for people to get connected to sort of strategies that might need to be broadened out.
And is every RCCC working on that early childhood education pipeline, people bringing people into the careers in
My
that?
understanding is that they each have their own regional plan that they've put together, and they're working based on that.
Okay.
And so the lessons learned from those things would definitely support statewide, my understanding. All right, I'm going to end the poll there and share the results. So yeah, that staffing piece really jumps out as something that people have really been hearing a lot about, but potentially fewer of us have an idea so far about how we're going to support this. And that's really helpful to us at ECIC because we are going to really focus in the upcoming year about business related services and what we might be able to get business support contractors to help us with implementing that has a research based background as far as being effective. Does anyone want to share anyone who does have a support with staffing, does anyone want to share what supports that they have found to be effective or plan to provide this year related to staffing? Totally okay. If not, that's definitely a very challenging one. Those plans definitely take time to come together. All right. I'm also looking at our time, and I want to make sure we discuss or have the opportunity to discuss the last slide here. So I will change over to that. And so these were just other noteworthy services that we saw requested that came up. With license exempt providers, some things that really jumped out to us were the involvement of fathers and also support with transportation. Those were things that we had not heard of or had not thought about, and were wondering if anyone else had experienced hearing those questions or hearing about those needs. And then similarly, we also saw a lot of questions related to professional development. One thing that was interesting was, again, we know you all are providing a ton of professional development resources. And so some of the quotes that stood, or one of the quotes in particular that stood out to us, is really thinking about what folks might mean by more in-depth training. We were curious about, where or how we would go about learning more about what specific needs that they are asking about there. And then, of course, pre-licensure is always a support that's needed. And we also know that technology is a real challenge, and people were thinking about people were asking about how they might actually sit down together with a supportive staff person and work on those things. But perhaps you all have experienced that. And might be thinking about other ways to support with technology. So I'm going to quickly launch this last poll. So once again, just naming which have come up for you in your network and which things you're either building a plan currently to address, or, obviously, if you don't have a plan yet, that's completely fine too. We are working on identifying either that you all have got it, working on it, good to go, or are looking for those additional supports that we can provide. And same thing as before, if anyone has any comments about anything on screen, I would love to hear those in the chat or coming off of mute.
I'll just add, we have a lot of great comments in the chat, just with helpful resources. I know Kristen added the Tucker Turtle info. So yeah, just wanted to encourage everybody to keep an eye on the chat as well, with just some great suggestions as well. And then we just got a question for Shemaine here at the end about, is it possible to have someone speak with the group about CDC payments, questions, and concerns?
Yes, definitely, Shemaine. That's something that we will look into, and I'll add that to. So anything that's in the chat, we'll make sure to summarize, and questions like that, we will look for those resources. And I think it would be great to have CDC payments questions and concerns answered in as clear a way as I think it was for us last time we had the opportunity to speak with folks. All right, I'm going to go ahead and end the poll there and show the results one last time. So yeah, technology needs are definitely a huge focus across the board for everybody. And I'm wondering if anyone has or is willing to share how they support with technology, whether that is like directly one-on-one support or whether they have other strategies or ideas related to making technology easier to access for people, less of a barrier.
So I'll share. I know, and I'm not sure what regions this meets, but I know we are having like an open office hours type thing for my registry questions and some licensing questions and stuff. Candy at Child Care Network is doing that. And so that has been super helpful for people to kind of call in. It also has been helpful for us too to join those so we can kind of help people who ask us as well. So those like kind of open office hours has been good. And then I also just in our region reached out to our licensing consultants and made connections kind of with them to ask some questions and be kind of a liaison for some of the the MyLeap or just kind of the licensing issues that may have come up. And so creating that relationship, has been hopefully headed in the right direction because I know sometimes that can be intimidating as well.
Yeah, thanks so much for sharing that. I think those office hours strategies are so good because you oftentimes people will hear questions or receive support that they didn't necessarily know they had a question about as well.
Sarah, are you aware that the state now there are office hours with the manager, a licensing consultant Okay. Yeah, so I attended last week and providers can jump on and ask any licensure question they have once a month.
Yeah, that's really awesome. And we've been trying to promote that too. It's hard, it's tricky with the timing of it all. And I'd like to jump on myself. But yes, that was I had kind of started this like as they were talking about that. So this being available has definitely helped with that bridge. So yeah, thank you.
Yep, I'm also seeing that a lot of one-on-one support is effective and helpful. And then also, Kelly shared having a licensing consultant come to the meeting each year and also giving like a sort of general and ongoing tip during the updates of each meeting. And I think that's really the challenge that we're trying to figure out is like the technology is super. It's always going to be there. It's going to be something that as business owners and people navigating state systems, they need support with. It is a barrier, and thinking about what does that system look like to be able to support people in an ongoing way, so that it becomes something that they feel more confident navigating. And as we heard also earlier in this meeting, thinking about what is our dependency on technology and thinking about where can we have in-person supports as well to supplement those things that are otherwise always virtual. Awesome.
Also, just a reminder about the office hours that those are announced in the Friday flyers. So just keeping an eye out in that flyer for those details.
Perfect. Thank you so much, Amanda. All right. So that wraps up our data review for the time being. We're going to continue. Like I said, there are a couple other questions that we want to dig deeper on, but this has been really helpful. We will summarize the sort of key findings from the chat for you all when we're sharing back out. Great. And then lastly, I'm going to turn it back over to Amanda, I believe. Oh, wait. No, I'm not. I will turn it over to Amanda anyway. I'm going to skip through the next few slides. We're going to have to find another time to talk through the Erickson evaluation report. But I do want to share that it is nearing finalization for publication. It's currently at the stage of having MyLeap review it, and then you will all have the actual report that's like, here's what we learned during FY25. Here are the directions that the outside evaluator, the Erickson Institute, is providing us with feedback from provider voice, their experiences, your focus groups, so the staff focus groups drive the changes that we're going to be making in FY26. And it also begins the data collection of the longitudinal evaluation. And so what's exciting about that is that you'll be able to see what kinds of questions are being asked to the network members that are going to be followed over the course of their experience. And it helps us, it'll detail the plan for you all as well about how we're going to be evaluating the initiative over the coming years. So I'm going to skip the next two slides, but you will be, again, they're all available for you to read, and I would love to chat more about them if you have questions. Or it's like 4 slides, yeah. So I'm going to now turn it over to Amanda to close us out.
All right, sounds good. Yeah, the time flew, but we really appreciate the discussion today. Super helpful. So before we close out, we just wanted to spend some time thinking ahead to 2026. And wanted to start just with the Child Care Innovation Fund's intentions for 2026. So one, we want to ensure that we are successful onboarding new hubs and making progress towards adding networks. Supporting all hubs, offering business supports that have an economic impact on home-based childcare, both licensed and LEP. So, as we have those just rich conversations during progress meetings, hearing from you all about where those business support needs are, as we, work to develop our proposal, and also identifying and highlighting high impact practices for replication across the initiative, just increasing that knowledge sharing and understanding. And the measure provider voice across the initiative as well, and really lifting that. So wanting to ensure that, those priorities were shared as we're so close here to 2026. And also just wanted to end and just do some reflecting with our last few minutes here, and would love for some of you to come off, either to share off mute or to put in the chat, as what is something that your hub would like to work on next year, and what do you need to make it happen? Anything
I'll
that
go
anybody?
first.
Oh, all right. Thanks, Julie.
Sure. We've recently had some of our network members express interest in providing professional development to our network. And so really, as many of you know, we're with the Saginaw ISD, we're a newer hub. And so anyway, they're just kind of coming into this building relationship and having this confidence. And so it'll be just supporting them and becoming approved trainers and helping them to provide those training opportunities.
I love that. Thanks for sharing, Julie. Wonderful. Anybody else?
So, we would like to make progress towards supporting business practices. We've had some that we've pulled in. For example, like mediation services was one that we pulled in last year. Unfortunately, it's no longer available. So some of the resources we've used in the past we're going to need to find new resources. So I feel like we're kind of starting over on that one. So that's going to be a big one for us.
Yes. Okay. Thank you. Also, Shemaine added in the chat. So my side will be creating more leadership opportunities for our providers. And I definitely heard that theme and focus of leadership and what that looks like in your networks during our progress meetings for many of you. And just the initiative piece too. I think that was another common theme of, just hearing providers who are asking, for more leadership opportunities as well. And that's great. One of your providers is planning to create a video of the testimonials about FCCN to share with other providers. Great idea. Wonderful. Well, one last question here we have on the slide. And again, feel free to come off mute for a second or just leave in the chat. Just about based on the discussions that we've had today, for you all to complete the sentence in 2026, our hub will.
One thing I want to highlight as well for us, I know that we're working on it does say that we're making sure that we're working on providing stronger business supports to you all. I know that that was something that Amanda discussed with many of you in progress meetings. We are making progress on that, and there will be a bid available for contractors that have proven strategies for increasing the sort of economic well-being of home-based providers. And I want to be clear that we're also making it a priority that anything that we provide has to both be supportive and relevant and improve the conditions of licensed providers and license exempt providers. That's a priority right now of putting that bid together, and that will be something that we really are able to work on in the latter 6 months of FY26. I'm seeing some great things come in the chat.
Yeah, more great things coming in the chat. I'll share these too, and then we'll move to just some reminders before we close out today. So Mainspring will continue to work with providers to provide them with business and community resources and more opportunities for their members to lead and showcase their talents and expertise. Wonderful. Arbor Circle, so striving to increase local business supports and provide opportunities for providers to grow as leaders in the childcare world. I love that language and framing. Great. All great things that, 2026 will be here in like 2 seconds. So all great things to set us off on the right path. So before we close today, just a few reminders about the first off, the updated roster and hub reporting survey. Again, that's reflecting TA from 10/1 to 12/31, are both due on January 9th. And then the feedback, our PLC survey, the link is now in the chat. I'll also make sure to include that in the post PLC email this week. And then for January, just to note, our meeting topic's going to be high quality meeting design. And that is everything we have. We hope you all have a wonderful holiday season and a happy new year. And we will see you all in 2026. Thank you.
Thanks, everyone.